Good morning, my name is Dr. Adams, and I'm just going to briefly go over a new procedure that we do here in our office that causes our patients to heal a lot more quickly during certain surgical procedures. We have a patient over here who is coming today with a lot of pain, routine thing, 4 wisdom teeth, generally the last tooth in the mouth. Very difficult to clean, so we're going to take out these teeth today, and then what we're going to do is we're going to ahead of time draw some of his own blood, which I've already done, and we produce the blood by spinning it in a centrifuge over here for 12 minutes at 27 RPMs to concentrate the platelets and the fibrin from his blood, helping him to heal a lot more quickly and also with a lot less pain, and most importantly causing the bone to reform properly in his jaw without bacterial and fungus and other things getting trapped in there. That's good. Okay, so here, for those of you who get grossed out, don't watch anymore, but we have 2 tubes of blood that we have pulled from the patient. This one right here has not been processed, and this one right here has been processed. And as you can see, there's 3 layers. There's the platelet rich area, which is red. This is mostly like red blood cells and other things. We have the platelet rich fibrin layer, which is right here. This is the layer that we're most interested in. And then the plasma, which is really just the liquid part of the blood. So what we do is we spin this blood in the centrifuge so that we can concentrate this yellow layer here that we're most interested in. And come on over here. Definitely a little gross, but it works great. This yellow platelet-rich fibrin area is what we're going to place into the patient's extraction site once the tooth comes out. We also have one other thing that we do. We also have oxygen and ozone gas. A lot of times in these extraction sites there are bacteria which are anaerobic, and there can be funguses and other things that have been leaking down in and around these unhealthy teeth. That's why we're taking them out. So we put the ozone and the oxygen down into the site, which does 2 things. It first off kills the anaerobic bacteria, and it also oxygenates the area so that the patient can heal better. So we're going to first oxygenate and ozonate the extraction site with the ozone and oxygen gas, and then we're going to second place the platelet-rich fibrin that we've isolated into the extraction site. And once again, this produces a really fast, painless healing cycle typically, and it will also, most importantly, cause the jawbone to heal properly without bacteria and fungus and other things getting trapped in the patient's jawbone. Here you see the ozone syringe. There's ozone and oxygen gas. We're placing it down into the extraction site. You can see the gas bubbling down into the extraction site. There's a little bit of blood in there, not too much. That's normal. That lets us know that the bone is healthy and alive. When it does not bleed, then we get a little bit concerned. The ozone, once again, oxygenates the area. It kills anaerobic bacteria. The ozone gas has an additional electron. It's O3 instead of O2. So it will have the effect of reversing some of the acidity in the unhealthy area. And the bone is an area where there's not a lot of blood supply, so there's not a lot of immune system in there. So to get ozone gas down into the pores of the bone really goes a long way to heal. The next thing that we're going to be doing is we're going to be taking our platelet-rich fibrin and placing it into the site. Okay, you probably have to zoom in. Okay, in this site, this site's been infected for quite some time, and right down in here you'll see a cyst. Good suction. I'm gonna make sure we get that out. There's a couple different things that can collect in these sites. First off, the bacteria. Secondly, the periodontal ligament, which actually typically in health connects the tooth to the jawbone. And then when these teeth stay in too long and they become chronically infected, you'll get this cyst tissue, which definitely we're going to take out, because otherwise it'll just stay trapped down in his jawbone along with a bunch of other bacteria, and they will survive. So here is Mr. Cyst. You got that? That has to come out. Okay. Okay, go ahead and roll.
Yep.
So now we're going to continue to clean this site. We're going to make sure we get the periodontal ligament out. I do believe there might be a little bit more scar tissue in here. Just keep rolling that camera. Okay. Okay, go ahead and give me the other. I'm going to put the ozone gas in next. Almost done, buddy. The ozone gas is what we do second. We're going to kind of quickly go through this because we're not all here for the fun and games. The ozone can be a little dry, so we'll suction so the patient doesn't have to smell it. It won't hurt anybody, it just can be a little dry and make people feel like they want to cough a little bit. We've got an upper extraction site that we've taken out, or upper tooth that we've taken out. This site isn't that dirty. Okay, now I'm going to take our Platelet Rich Fibrin. Go ahead and suction in there. I'm going to place that down into our site. Voila. Grab me the suit. And this is really all I wanted to show you. I'm going to go ahead and place like one little stitch in here to close this up really nicely. And that's how you properly take out a chronically infected wisdom tooth and use platelet rich fibrin to cause it to heal well. Okay, that's good.